Hello everyone, and welcome to this audio podcast. This audio podcast is part of a lab side, the lab side archetype edition, as part of another radio edition, under as part of a Storm Robotics production. This is an audio podcast as part of a Bostics Blast, and this audio podcast is part of a Biomed Alchemy, and this audio podcast is an interlude as part of the interlude. So in this audio podcast, there will be an overview in looking at health health inequalities, and looking at kidney care for all. This works was originally peer reviewed and published in a medical journal, scientific and medical journal, in 2022. This works this peer review works was a collaborative between two social media platforms, and where the authors had looked at aspects of health inequalities, and looked at sort of now health inequalities in context of nephrology and kidney care. And so the overview is as thus. So in the United Kingdom, or the UK, unfortunately, one of the main issues surrounding healthcare is that patients or healthcare service users with chronic illnesses like CKD are restricted to NHS, the National Health Service, healthcare services, and approaching other sort of healthcare providers and approaching sort of healthcare providers in context of at least where healthcare is specific to CKD or chronic kidney disease. So further complications can arise, especially for those who have healthcare challenges, and where misinformation can lead to fragility and health inequalities. Patient and public involvement, or PPI, can help bridge issues surrounding health inequalities. In around the aims of this works. There were in around this works there were several there are a few aims and objectives to identify one whether where patients or service users, healthcare service users with CKD or chronic kidney disease would like to approach health professionals, and healthcare service users, other healthcare service users, through online consultations and through online consultations for educational support, and thus prompting collaborative efforts. And two, to understand if and whether CKD patients or healthcare service users would welcome sort of a more integrative support from healthcare professionals through social media, wherein patients and professionals, healthcare service users, and healthcare service providers can bridge gaps across healthcare inequalities. So around the methodology of this, in support of World Kidney Day, or what has been referred to as World Kidney Day 2022, this works, or this original works, sought to highlight how health inequality can be bridged through online spaces and integrated practices between healthcare service users and healthcare service providers. In around the discussions of this works, healthcare service users or patients are highlighted as intermediaries between healthcare sectors or healthcare services. CKD CKD service or healthcare service users now have opportunities to share lived experiences owing to the nature and implementation of social media platforms like the Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support Group, or KDARS Group for Kids. In around the conclusions of this peer review works, or this works from 2022. In addition to sharing experiences, this prompts healthcare service users to be more than mere recipients of healthcare. CKD patients or healthcare service users become more empowered, so that more informed decisions can be made. In around the sort of summary of this work's education intercessions are required generally to offset issues where there are inequalities, but also to ensure excellence in and across healthcare practices. Some terminologies that can be used to identify similar works around this include healthcare, education, screening, and long-term conditions. So thank you for tuning in on this interlude, and part of this audio podcast as part of a part of a LabSite archetype edition, and this has been an audio podcast as part of an interlude as part of the Biomed Alchemy, and this is audio podcast as part of another Bostix blast. Thank you for tuning in on this Storm Bostix production.